what happens if you don't do physical therapy after a total knee replacement? What's going on, guys? Tony Maritato here, licensed physical therapist, and you probably expect me to come on with some horror stories about people who didn't follow the advice, they didn't do their physical therapy, and they had tragic results. The reality is, it's way more complicated than that, and you guys know it for sure. Everybody is different. I see patients in their 40s who have a total knee replacement, and within 2 or 3 weeks, you would never even know they had surgery. Conversely, I see people in their 60s, 70s, and 80s who have had knee replacements, and they're struggling at 12 months post-op trying to regain the range of motion that they want. Everyone is completely different. There is no simple answer to this. So if you're in the Facebook group, Total Knee Replacement for Kind People, you likely saw a recent conversation about a surgeon who told his patient not to go to outpatient physical therapy because it would likely result in increasing the inflammation around the knee. Now, I totally get it. I'm not on one side of the fence or the other. I have heard those horror stories. You guys have shared your stories with me. You've been to a therapist that maybe pushed a little too hard or did a little too much or expected more than your body could handle, and as a result, you had a flare-up. I've been guilty of it myself. I was a new therapist once. I didn't realize how deconditioned somebody could be and how little a level of activity it took to put that person over the edge. So I can empathize with the patient who comes back to therapy, if they ever come back, after a bout of, delayed onset muscle soreness and misery. But I can also empathize with the surgeon who says, don't do therapy, you can do it on your own. The reality is, you have to understand, you're the patient, you have to be your biggest advocate. You have to understand, what are your goals for therapy? What do you expect to get out of therapy? I can tell you that I think the greatest value I deliver to my patients isn't the physical therapy service, but rather the peace of mind. We had this conversation in the clinic today, 2 or 3 patients who had total knee replacements, who were in the clinic together. We were all talking and having a good time. And I brought up this topic because I knew I was going to record a video about it tonight. And I said, what do you guys think is the most important thing you get from coming into therapy? And as much as I would love for them to say, well, it's the amazing skills of my therapist, it really, for one, was the motivation. She acknowledged that she doesn't push herself quite as hard as she pushes herself when she's in the clinic. So having the motivation of coming to the clinic and doing things that you wouldn't otherwise do for yourself is a huge component of why you go to therapy. Another person said the peace of mind, the reassurance, the fact that, her therapist, me, I've seen hundreds and hundreds and hundreds of individuals who have had total knee replacements. When she asks me a question, I have the history and the experience to answer that question based on real experiences. So she feels much calmer knowing that there's somebody like me in her corner. Somebody like me who can support her, coach her, educate her. Somebody else, they were basically saying that they love access to the equipment, they love being part of the community, they love coming into a clinic where there's other people going through the same thing that they're going through. Because when they go home, this particular individual said there's nobody there giving them any kind of sympathy or empathy. Everybody at home expects them to be back to normal within 24 hours of surgery. So we give that individual kind of the emotional, the psychological support that they need, and the acknowledgement to say, hey, you just went through major surgery. There's a lot of stuff going on. From you're not sleeping well, you're not eating well, your bowel and bladder isn't going the way it's supposed to. All of that stuff combined takes a lot out of a person. Even the strongest person has moments of weakness, and if you don't have the support team around you to support you through that, that's when you really start to struggle. So I would tell you that physical therapy is about a lot more than just somebody helping you with the range of motion and somebody helping you to get things done that you wouldn't otherwise do. Physical therapy is about support. It's about asking questions, about connecting with a community that maybe you don't otherwise have access to. So, do I think you need physical therapy? Yes, I think you do. Is there an opportunity for somebody to get it done on their own? Probably. Could it be as good of an experience as, going to therapy? Maybe, maybe not. The bottom line is there is no wrong answer. If you don't have access to an amazing physical therapist, you're going to do fine. Find people around you that can support you, that can educate you, that can help you through the process. But if you do have access to an amazing therapist, you are one of the fortunate few, and I wish you the best. If you guys have questions, let me know. Otherwise, I think my family is getting ready to head out for the night, and I better go catch them. So I'll catch you guys on the next video. Check this video out, because I think YouTube is going to recommend this for you based on what you've been watching already. So I wish you the best.